For coming. For those who do not know me, I'm Dr. Flucher. I'm an interventional cardiologist, and we will be talking about diet and exercise that would be healthy for our hearts. There's so many things that I would like to say. I originally thought that I would organize this talk to be a 20-minute talk. I cannot refrain. I think I will make it about 30 minutes or 35 minutes or so with your for your benefit. It is a community talk meant to help us all and meant our patients understand why we do recommend exercise and diet appropriately, what is the basis of doing this, and some guiding principles in terms of how we can achieve these goals. A dear friend of mine also recommended that and some of them in the audience know him well, recommended, why don't I also put some motivational slides? Once we decide that we want to do this, how are we going to achieve these things? So without further ado, let me start. From the get-go, I want to say that I have no financial disclosures, no relationship to any industry in regards to this topic. This lecture does reflect the current knowledge that we have on these topics nowadays. We all need to stay tuned as our knowledge and science would advance in this field, and it is just natural to happen. So stay tuned. These changes are these recommendations are the recommendations that we know of nowadays. They are probably the best, but things might change. We will learn more. Before implementing such recommendations, I would say that our patients definitely need to see their physicians first. The physicians are able to tell them whether they can undergo these changes, whether they need further testings to see whether such recommendations can be implemented right away, and to what extent they can and should be implemented. That is, if the physician has not already made these recommendations, and here they are. The background slide is always the alarming slide, and this slide pretty much, as I do such lectures over time, I'm observing that this background slide pretty much stays the same over the years. The American Heart Association issues each year one document at the beginning of the year in regards to what has happened in the previous year. And it is striking for us to observe that still 1 in 3 Americans have one or several forms of a cardiovascular disease, that since 1900, cardiovascular disease is unfortunately #1 in death, to the extent that cardiovascular disease claims more deaths than cancer, plus lung disease, plus accidents. This is alarming. The other alarming number is that 1 person dies every 39 seconds because of a cardiovascular disease. So my thought goes to, what can I do to decrease my cardiovascular risks, be it in a person that has never had a heart disease or in a person that did have a established coronary artery disease or a stroke or any vascular disease, as a matter of fact. So we need to attack the keyword being modifiable cardiovascular risk factors. And this is, the American Heart Association is very busy in this direction, and they have enumerated the number of risk factors that we can try to change. And I will just go quickly over them. For instance, smoking, reducing the cholesterol and choosing a good nutrition, lowering the high blood pressure values, being physically active, aiming for a healthy weight, managing diabetes, reducing stress and limiting the alcohol consumptions are key recommendations here. Out of these many recommendations here, I will just focus on essentially on choosing a good nutrition, and this would have impact on reducing and improving our cholesterol numbers, and on being physically active, as I said. So the first part will be on recommending a heart-healthy diet. The little star there has to say that I will not go into recommendations for diabetic persons. It is a separate, I personally consider it that as a separate chapter. So let's go ahead and see, why do we need a healthier diet and what should we do? If I'm looking at the diet, my first thought as a cardiologist goes to the fat components, goes to cholesterol. So I'm looking into that, and we have nowadays understandings of which are the bad fats in our food and which are the good ones, which ones we should avoid, which ones we should not avoid. So the trans fatty acids are probably the most evil doer that we have nowadays in terms of fat components in our food. Other keywords are trans unsaturated acids or partially hydrogenated fatty acids. These are keywords for us to remember as unhealthy lipids. Some of them occur naturally, such as in products of animal fat, but some of them, and many of them, are unfortunately produced by our industries. The more renowned one is the stick margarine that was used to keep those pastry products stiff and look good, and so forth. Another representative, a famous other representative, is given by the deep fried foods, all the French fries and all products as such. In regards to those margarines that I have just mentioned, commercially baked foods, unfortunately, such as cookies, cakes, pancakes, danishes, the famous donuts are the ones that have high contents on of trans fatty acids. They all have, people who have increased amounts of servings of these foods per day have clearly been shown to have an increased cardiovascular risk. Another bad component in our food is represented by saturated fatty acids, and these are represented by red meats and by dairy products which contain such saturated fatty acids. Also, high increased consumption of these products has shown to be increased with shown to be correlated with increased coronary artery disease. Now, I'm also shunting out of my presentations here some of other components, namely the LDL cholesterol, which we call the bad cholesterol, or the HDL cholesterol, which is called the good cholesterol. These types of fats that I called right now have impact on these lipids as well. But for me, as a clinician, the most important thing is the hard endpoint outcomes: less or more cardiovascular disease, less or more death. The good fats. One keyword here is monounsaturated fatty acids. Where do we find them? Olive oil, canola oil are notorious nowadays, and they have been shown to reduce heart disease. Other good fatty acids are represented by the group of polyunsaturated fatty acids. One of them is the N6-linoleic acid, again a fancy name, but what we need to remember is safflower, sunflower, or corn oil. These have probably been linked by studies with, probably been shown by studies to decrease the cardiovascular risk. The more notorious and the better known unsaturated fatty acids nowadays are represented by the N3-linoleic acids, which are better known as the omega-3 fatty acids. What are these? Where do we find these? Well, fish oil, canola oil, nuts, flaxseed or flaxseed oil, or soybean. They have been shown to decrease cardiovascular risk. They improve the lipid profile. They decrease death, and also known in studies to decrease the chance of sudden death. In every of these slides, I'm presenting also the data that supports the statements for whoever wants to look into them and have a better understanding. These are scientific papers that I'm showing there. A study that I'd like to show as being successful in this direction is a study where patients were recommended to replace butter and cream with a margarine which is rich in monounsaturated fatty acids, but on top of that it was fortified, if you will, with the omega-3 fatty acids, having higher contents than usual. And this study has shown actually significant reduction in cardiovascular mortality and cardiovascular risk. Now, all said and done, it gets to the simple point of taking out the bad ones and putting the good ones in. What else do we need to do in terms of getting a healthy heart diet? Well, it was shown that, again, on the same theme, as we reduce the animal protein in our foods, and as we increase the vegetable proteins and fat, the chances of death gets to be decreased. Which are substitutes for the unhealthier proteins? These could be fish, legumes such as beans. One should not forget soy. Nuts are healthy here, and poultry, to a lesser extent, but still present, is an option for substitution of red meat. Also talking about carbohydrates. This is another key point here. And we doctors are using fancy names such as glycemic index or glycemic load, two different ways of assessing these food components, in which we're trying to establish this particular carbohydrate. Is it going to give me a lot of calorie? Is it a calorie bomb, such as sugar? Will our body transform it into fat, or will our body transform it into circulating fat, which increase the cardiovascular risk? Or do they have less exposures? The healthier one, the healthy carbohydrates, are represented mainly by the unprocessed whole foods and grains. These have been shown to reduce the LDL, namely the bad cholesterol. So an important fact to remember, again, replace the bad ones, the calorie bombs, put back instead of them the good carbohydrates, the healthier carbohydrates that have an impact on our life. Also, adding fruits daily, up to several servings, vegetables and legumes are important, and this has also been shown to improve health by reducing the LDL, namely the bad cholesterol. I'm thinking of all these things, and I'm saying what is the best way of putting all these recommendations together and all these observations together in having a meaningful and appropriate diet. And it turns out that if I'm looking and studying these, the Mediterranean diet is the type of a diet that comes closest to accumulating all these recommendations and putting them in one. And this is the pyramid of a Mediterranean diet that most of the audience, I'm sure, is well aware of nowadays. And the base of the pyramid is represented by the foods that we should eat more often. The tip of the pyramid is represented by the foods that we should eat less often. So, at the base of the pyramid, we have the unprocessed grains, such as breads, rice, couscous, polenta, bulgur, other grains, even potatoes, and pasta. On top of it, we have vegetables, which we have to have several servings of vegetables per day, and they are the bulk. If you look at your plate, these are the bulk in your plate. Fruit need to be served. Now, in the Mediterranean diets that have been studied, for instance, red wine has not been forbidden. In women, up to 1 glass of red wine per day has been considered healthy. In men, up to 2 glasses of red wine per day. And it also goes with the equivalent of alcohol contained in those glasses of wine. However, for instance, in studies that have been performed when they counseled patients, if someone was not using red wine, it was not recommended that that particular person start using red wine as a medicine. It is not a medicine. But for persons who used more, limit yourself just to these amounts. This is what is considered nowadays as the healthy limit. On top of these, we have the beans, the legumes, and the nuts. Nuts, for instance, 1 handful of nuts. There has been no trial showing that one nut would be better than others. Nuts that have been most frequently used are represented by the walnuts. And then olive oil is the oil that has been recommended in these diets. Cheese and yogurt can also be used on a daily basis, but see, the pyramid is also already slimmer here. You should not use as much cheese and yogurt as you use the other ones. And then yogurt, probably a low-fat yogurt is the one that would be recommended. These are to be used daily. We're going now into foods that are to be used maybe up to 5 times per day. And the bulk here is represented by fish. Fish is considered to be healthy. It is rich in the omega-3 fatty acids. Studies on Eskimos and their longevities have pointed into that direction. Poultry can be used, and eggs can be used, and again, these are to be used for probably no more than 5 servings per week. Now, the tip of the pyramid is represented by the concentrated sugars, the sweets, and the red meats. The red meat being represented by beef, pork, lamb, the typical representatives here. These are not to be abused of. Now, the Mediterranean Sea is surrounded by some 15 countries. There have been several studies and several diets, and in all these recommendations for the red meat, there is a whole spectrum of how thorough or how lax these recommendations should actually be. The softer ones would go with red meat servings up to 2 to 3 servings per week. The thorougher ones go with recommending 2 to 3 servings of red meat per month. So it is within that range. The one thing that we should not forget that has been emphasized in people who have been studied implementing such diet is the regular exercise. I will come back to this topic.